This video will give you an idea of what to expect when you come to Memorial Sloan Kettering's Josie Robertson Surgery Center on the day of your surgery. Plan to be at the Josie Robertson Surgery Center at the time you were given the day before your surgery. When you arrive, use the entrance at 1133 York Avenue between East 61st and East 62nd Streets. Once you arrive, our concierge will greet you and direct you to the check-in area on the third floor. When you get to the third floor, a member of our staff will give you and your caregiver badges to wear. These badges will allow your healthcare team to provide updates on your progress. We will also ask you for the name and contact information of the person who will take you home when your surgery is finished. After you check in, a member of your healthcare team will bring you and your caregiver to the pre-surgical center on the 6th floor. Here you will meet with other members of your healthcare team. They will review your medical history and answer any questions you may have. Up to 2 of your visitors will be able to wait here with you. When it's time for your surgery, your nurse will bring you into the operating room. While you're in surgery, your caregivers will wait for you on the 3rd floor. There's a cafe, Wi-Fi, and charging stations available for them to use. When you get into the operating room, you'll probably notice it's chilly, but your bed will be warm. You may also notice lots of equipment and people in the room. We know this can be overwhelming. Just know that we are all here for you, and we'll make sure that your surgery goes smoothly and safely. Once you're on the warm table, we'll put a safety belt on you and connect you to monitors. This will allow us to monitor your heart rate, blood pressure, and oxygen levels throughout your surgery. When it's time for you to go to sleep, your anesthesia provider will have you breathe oxygen from a mask. You will then be given medications through your IV, and you'll drift off to sleep. When you're in surgery, our nurse liaison will go into the operating room to get updates and share them with any friends and family you have with you. When your surgery is finished, you'll wake up in the operating room. Most people don't remember this because of the anesthesia. You will then be taken to the recovery room. In the recovery room, you'll be attached to monitors so we can monitor your heart and your breathing. Depending on your surgery, you may have drains or other medical equipment. Your nurse will work with you and your surgeon to make sure you're getting the medication you need for pain. After your surgery, a member of the healthcare team will escort up to 2 of your visitors to your side. When you're awake, your nurse will encourage you to walk, give you something to eat and drink, and review your discharge instructions with you and your caregiver. Depending on the type of surgery you had, you may stay at Josie Robertson Surgery Center one night. If your healthcare team feels you need to stay longer, you will be taken to Memorial Hospital, located at 1275 York Avenue. If you do need to stay overnight, we strongly encourage your caregiver stay overnight with you. Only one person may stay overnight, and accommodations will be made for the caregiver to stay with you in your room. If you have any questions about how to prepare for your surgery at Memorial Sloan Kettering, call your surgeon's office